Ladies, listen to me very carefully. If you're over 60 and a doctor asks you any of these 6 questions, you need to walk out because they either don't know what they're doing or worse, they're lying to your face. This video may just protect your health, your independence, and your dignity. So please watch until the end. And if you've ever been asked something questionable by a doctor, drop it in the comments below. I'm reading every single one. And don't forget to like and subscribe if you care about real health advice for older women. Let's begin. 1. Are you sure it's not just your age? This is one of the most infuriating and dismissive questions any older woman can hear in a medical setting. And unfortunately, it happens every single day. You walk into the office because something doesn't feel right. Maybe your joints are stiff in a way that doesn't feel normal. Maybe your heart is racing more often, or your memory isn't as sharp as it used to be. You explain this carefully, clearly hoping for answers. And the doctor leans back and says, "Are you sure it's not just your age?" Let me tell you, I've heard that sentence destroy trust in an instant, because what it really says is, I'm not going to investigate. I don't believe your concern deserves effort. I've already made up my mind based on your age alone. That is not medicine. That is ageism in a lab coat. I once had a patient in her late 60s who complained of chest discomfort and nausea. Her doctor waved it off as indigestion and said, "It's probably just your age." She had a minor heart attack 2 days later. That doctor's dismissal nearly cost her life. The phrase "just your age" has been used to ignore treatable thyroid issues, early dementia, autoimmune diseases, and even cancers. When doctors lump every symptom into just aging, they erase your individuality, your medical history, your genetics, your habits, all of it. Yes, aging brings changes, but pain is still pain. Fatigue is still fatigue. And a new symptom is always worth attention. You deserve a doctor who investigates, not excuses. So if you hear this question, with no further inquiry, no tests, no thoughtful conversation, you owe it to yourself to walk out and find someone who sees you as a person, not a stereotype. 2. Do you really want to do all these tests at your age? Now, this one might sound like concern on the surface, but underneath, it's often a deeply troubling suggestion that you are not worth the time, money, or effort. Let's say you're dealing with confusion, shortness of breath, or abdominal discomfort that keeps waking you at night. You finally book the appointment, sit down with your doctor, and they start listing the necessary scans and lab work. But then, suddenly the tone shifts. They pause and say, "Do you really want to do all these tests at your age?" You see the problem here? It implies that seeking answers is somehow selfish or excessive, that your age alone means you should accept discomfort, confusion, or decline without question. And I'm here to tell you that is not only insulting, it's reckless. One of my patients, 76 years old, had been complaining about sudden mood swings and foggy thinking. Her doctor initially said it was normal aging, and then when she pushed back and requested imaging, he responded, "Do you really want to do all that?" She came to me. We ran the tests. Turned out she had a vitamin B12 deficiency and a urinary tract infection, both of which were treatable, both of which mimicked dementia. She didn't need to suffer. She just needed someone to take her seriously. If a doctor is going to suggest skipping tests, they better have a clear, evidence-based reason, not just a dismissive opinion about your age. Because your body deserves care. Your symptoms deserve investigation. And you deserve the same standard of care you would have received at 40 or 50. So if they suggest otherwise, don't hesitate. Get up and go. 3. Are you still sexually active? Let's talk about one of the most awkward, misused, and often inappropriate questions doctors ask senior women. Are you still sexually active? Now, before we go any further, yes, in some cases, this question has genuine medical relevance. If you're experiencing urinary symptoms, pelvic discomfort, vaginal dryness, or hormone concerns, then sure, it's worth discussing. But only if the question is asked with care, clinical intent, and respect. Unfortunately, that's not how many senior women experience it. Too often, this question is thrown in casually with no context, no warning, and worst of all, a tone that implies judgment, surprise, or even amusement. I've heard stories from older women who went in for back pain or blood pressure issues, and completely out of the blue, the doctor asks, "Are you still sexually active?" Still, as if sexual health disappears with your last period, as if a woman enjoying intimacy in her 60s, 70s, or beyond is somehow shocking. That kind of question, asked the wrong way, feels invasive. And the result? Women shut down. They avoid discussing real concerns about intimacy, hormones, or discomfort because they've been made to feel embarrassed, ridiculous, or like their body no longer matters. One of my patients, 82 years old, confident, and proud, told me the way he asked it, "I felt like a naughty teenager being caught. I just lied and said no." She wasn't ashamed of her relationship. She was ashamed of how she was made to feel. So here's the truth. You are never too old to deserve respectful medical care. If that question is relevant, it should be explained. And if it's not relevant, it should never be asked at all. And if the tone is off, the attitude is condescending, or it feels like a veiled insult, you don't owe that doctor another minute of your time. 4. Are you still living alone? Now, this one may sound innocent, but there's something deeply unsettling about the way it's often asked. Are you still living alone? With emphasis on the still. Why is that single word such a problem? Because it implies that living alone as a senior woman is something unusual, dangerous, or even irresponsible. Let me tell you, many of my patients over 65 are incredibly independent. They cook, drive, volunteer, lead church groups, hike, and yes, live alone. Not because they have to, because they want to. But when doctors ask this question in a way that's laced with suspicion, or worse, pity, it can feel like your independence is on trial. And for many women, that's the very last thing they want from a medical appointment. One of my patients, 79 years old, sharp as ever, had managed her own finances, medications, and home for decades, came in with a mild foot injury. The doctor spent more time questioning how she gets her groceries than actually examining her ankle. She told me, "I walked out feeling like I needed to prove I wasn't helpless." That's not medicine. That's condescension disguised as concern. Now, if a doctor is asking because there's genuine concern, like cognitive changes or frequent falls, that's different. But it must come from a place of respect, not assumption. If you're living alone and thriving, you should be celebrated, not questioned. And if your doctor asks this with a tone of doubt, or starts implying you need supervision before assessing your real situation, it might be time to find someone who treats you as capable first, not fragile. Because no matter your age, living alone doesn't mean living at risk. It means living on your own terms. 5. Do you want to talk to your daughter about this first? Now this one can really sting. And the reason is simple. It strikes at your ability to make decisions. You're sitting there discussing your treatment options or a new medication. You're listening, asking smart questions, weighing the pros and cons. And suddenly, the doctor says, "Do you want to talk to your daughter about this first?" Now, I want you to pause for a moment and think about that. Would they ask a 45-year-old man if he wants to consult his adult child about a prescription? Of course not. But for some reason, when you're an older woman, your judgment is up for debate. It's as if you've suddenly lost your ability to understand your own health and make your own choices. One of my patients, 68 years old and recently widowed, went in to discuss a possible knee replacement. The surgeon explained the procedure, and before she could even respond, he asked, "Would you like to bring your son in to help you decide?" She was stunned. She said, I wasn't asking for help. I was asking for options. And here's the worst part. Questions like this can plant doubt. They make women second-guess themselves. They feed into the stereotype that older women are fragile, forgetful, or incapable. Let me be absolutely clear. Unless you've given your doctor legal documentation stating that a family member is involved in your care decisions, they should be speaking to you, not around you. You have a right to make your own choices, ask your own questions, and take control of your own care, just as you always have. And if a doctor doesn't respect that, they don't deserve your trust. 6. Are you sure you want to keep taking that medication? Now, on the surface, this one might sound helpful. After all, a good doctor should review your medications regularly, especially as we age and our bodies change. But here's the issue. Too many doctors ask this question without offering any plan, any explanation, or any understanding of what that medication is actually doing for you. It becomes less of a conversation and more of a warning. Are you sure you want to keep taking that? Almost like they're trying to scare you off of it without giving you a clear reason why. Let me give you an example. I had a patient on a mild antidepressant. She'd been taking it for years, and it had helped her stay balanced and active after the loss of her husband. A new doctor came in and said, "We don't usually like older patients staying on these long-term. Are you sure you want to keep taking it?" No review of her mental health. No suggestion of alternatives. Just subtle pressure to stop, as if it were her responsibility to age out of her treatment. Guess what happened? She tried going off. And within a month, she was isolated, anxious, and calling her kids in tears. That's not how medication management is supposed to work. If you've been on a drug for years and it's working, there needs to be a very good reason to change it. And if a doctor wants to stop it, they need to explain why, discuss side effects, offer a safe plan, and most importantly, listen to you. Because you've lived with this body longer than they've studied medicine. If they can't offer a better solution, and they're just pushing you to drop something that's helping you, that's not care. That's arrogance. And you can and should walk away.